Stop. Before you seek therapy, you need to know this. Not all psychological treatments are safe. Some are dangerous. Some are even banned. Today, we're exposing the dark side of psychology you need to know about. There are psychological therapies that were once promoted, but are now condemned worldwide. Understanding these helps us champion the safe, evidence-based mental health practices that truly transform lives. First up, conversion therapy, often disguised as reparative therapy or sexual reorientation therapy. This is a critical topic for anyone interested in ethical psychology and LGBTQ+ mental health. This harmful practice aimed to change a person's sexual orientation or gender identity. But let's be absolutely clear. There's no scientific basis for it. Instead, it inflicts severe psychological harm, leading to crushing depression, self-harm, and tragically, even suicidal thoughts. Today, conversion therapy is either banned or heavily restricted in many countries and regions. Every major psychological, medical, and psychiatric association unequivocally condemns it as unethical and deeply damaging to mental well-being. Next, we delve into rebirthing therapy, a deeply flawed and dangerous technique that aimed to simulate the experience of birth, supposedly to release past traumas. It's a stark example of therapies to avoid when seeking trauma healing. The theory was that by recreating the birthing process, individuals, often children, could resolve early developmental issues or attachment problems. But the reality was horrifying. In one tragic and widely publicized case, 10-year-old Candace Newmaker died during a rebirthing session after being smothered under blankets and body pressure. The technique was meant to help her bond with her adoptive parents, but instead, it turned fatal. This dangerous therapy was swiftly outlawed in places like Colorado and North Carolina. It serves as a chilling reminder that not every emotional or psychological theory is safe or even remotely acceptable in practice. Always prioritize safe therapy options. Facilitated communication. FC. The illusion of breakthrough. What about a therapy that appeared to be a genuine miracle, offering hope to desperate families, but turned out to be a cruel illusion? This is the story of facilitated communication, or FC, a controversial method in autism therapy. FC was used primarily with individuals with autism or severe communication disabilities, promising a breakthrough. A facilitator would physically guide the person's hand or arm, allowing them to type out messages on a keyboard. However, rigorous scientific studies conclusively proved the devastating truth. The messages were overwhelmingly coming from the facilitator's subconscious, not the client's. Like a psychological Ouija board, it created false hope, leading to emotional distress, and in some harrowing instances, even false accusations of abuse. It underscores the importance of evidence-based practices in special education and communication disorders. Recovered memory therapy, MRT, the dangers of false memories. Another highly controversial and damaging method was recovered memory therapy, or RMT. This raises crucial questions about memory recall and the ethics of trauma therapy. The premise was that traumatic memories, particularly of childhood abuse, could be repressed deep within the subconscious and then unlocked or recovered through suggestive techniques like hypnosis, guided imagery, or even dream analysis. But these methods often led not to genuine memories, but to the creation of vivid yet entirely false memories, including devastating false criminal charges. Neuroscience has since confirmed what many suspected. Human memory is not a perfect tape recorder. It's reconstructive, fragile, and alarmingly susceptible to suggestion and external influence. This is why ethical psychotherapy emphasizes careful memory work. The importance of ethical and evidence-based mental health care. These unsettling examples clearly show us that good intentions aren't enough in the complex world of mental health. Every practice must be rigorously evidence-based and adhere to the highest ethical standards in psychology. Today, reputable psychologists and mental health professionals exclusively use treatments backed by robust scientific research. Approaches like cognitive behavioral therapy, CBT, eye movement desensitization and reprocessing, EMDR, and acceptance and commitment therapy, ACT. These methods are proven to help people heal safely and effectively, without causing further pain. True mental health care should never, ever cause more harm than good. The lessons from these banned therapies powerfully teach us why unwavering ethics and sound science must always go hand in hand. If you found this information valuable, please like, share, and subscribe Psychology Secrets.